So you really want to learn about diagnosis of tissues. Then listen to the following tips. Firstly, examine your tissue on your slide. Is it hollow? That is, does it have a lumen, or is it compact? If it is hollow, then examine the lining, the inner lining of the lumen, and determine which epithelium it carries. Is it columnar epithelium? Then think of the gut, beginning from the stomach right down to the upper part of the anus. Is it squamous epithelium? Then think of the esophagus, and also the lining of the buccal mucosa and the tongue, including the vagina. Is it pseudostratified epithelium? Then think about the respiratory tract. Is it transitional epithelium? Then think about the urinary system, beginning from the ureters to the bladder and right down to the upper part of the urethra. Also think about the lumen and the organ itself. Is it large or is it small? If it is large, then think about such organs like the trachea and most parts of the gut, excepting the appendix. If it is small, think of the appendix, the ureter, the urethra. Is your organ on your slide compact? That is, it does not have any lumen. Then think about the following. Is the compact organ large or small? If it is large, then think about large organs like the liver, the spleen, the suprarenal gland. If it is small, then think about smaller organs. Also examine to see whether any of these could be a gland, like the liver, the spleen, the kidney, or it could be one of the basic tissues of the body, like the nervous system, muscular system, connective tissue, epithelial tissue, sclerosed tissue, which includes bone or cartilage. Globule in a single gland. They tend to fill the whole cytoplasm, thereby pushing the nucleus of the cell to the side. During tissue processing, the fat globules dissolve out of the cells, and the cells now appear with holes which are characteristic and therefore diagnostic of adipose tissue and their contained adipocytes. For differential diagnosis, adipocyte cells have holes as a result of the fat globule removed during tissue processing. Lungs have alveoli which look like holes. The difference is the septum between the alveoli and the lungs. What adipose tissues have are cell membranes and the remaining cytoplasm. But what surrounds the holes of the alveoli are alveolar epithelial cells. Other organs with multiple luminous structures, such as testes and kidney, have very thick interluminal walls. cortex and a medulla. Its cortex is further divided into three zones as follows: zona glomerulosa, which produces mineralocorticoids; zona fasciculata, which produces glucocorticoids; zona reticularis, which produces sex hormones. Its medulla secretes catecholamines, that is epinephrine and norepinephrine. The differential diagnosis of the adrenal gland is as follows. It can be confused with all other compact glands that have no lumen. It is easily confused with the pituitary gland or any of the lymphatic organs, but its characteristic zonulation is very prominent. In the human body, it has an inner coat called tunica intima, which is made up of epithelium, basal lamina, and subendothelial connective tissue. It has a thick middle tunica media and a generous outer coat called tunica adventitia. The media extends from the internal elastic lamina, which is a membrane, to the external elastic lamina. The inner lining is made up of endothelium, which is separated from the media by the internal elastic membrane. Between the endothelium and the internal elastic membrane is the subendothelial connective tissue or cushion. The aorta can be confused with any luminal organ, but its wide lumen makes it easy to make out. It is devoid of villi or mucosal fold and must be distinguished therefore from colon, appendix, which contains many lymphatic rings, trachea with pseudo-stratified epithelium. The epithelium is a form or a modified form of squamous epithelium and is of a simple variety. Diagnosis of the appendix can easily be made out because of the lymphatic rings of the mucosa, which are purple, extending into the submucosa, which are green. Because of these nodules, the lumen is very small. The crypts of lubricant are short, for the appendix does not do very much of absorption or indeed secretion. Now, small luminal organs can easily be confused with the appendix, which for example include ureter, fallopian tube, and vas deferens. The vas and the ureter have very thick muscular coats with very little mucosa or lumen. Fallopian tube can be distinguished by its numerous branching mucosal folds. artery and vein or blood vessels. They are made up of three layers: tunica intima, tunica media, and tunica adventitia. The intima consists of the endothelium, basal lamina, and subendothelial cushion. The media extends from the internal lamina to the external elastic lamina in most arteries. The blood vessels are stained with eosine so that elastic fibers are stained dark. Examine the configuration of the elastic laminae in the two vessels and some scattered elastic fibers in the media. The arterial media is mainly made up of smooth muscle, which is thicker than that of the vein. The adventitia is common to both the artery and the vein in this neurovascular bundle picture. Differential diagnosis. Blood vessels are small luminal organs and can be easily confused with appendix, ureter, or small bronchi. Small bronchi have similar features as trachea, and an appendix has characteristic lymphatic nodules, while vas deferens and ureters are highly muscular. The breast or mama has numerous secretory alveoli from which milk is secreted. Milk is then passed into interlobular ducts and then to lactoferral ducts. Mama is arranged in lobules like liver and pancreas. Differential diagnosis. The breast or mammary gland can be confused with organs which have secretory holes such as breast, alveoli, kidney, tubules, and pancreas, acini. Pancreas has distinct islets. Kidney has glomeruli, and the acini are pinkish staining in the pancreas. Cardiac muscles are identified by their intercalated discs, which are usually prominent in longitudinal sections. Differential diagnosis. Muscle fibers can be confused with each other. Striated muscles have obvious striations, both transverse and longitudinal. Smooth muscles are devoid of striations, while cardiac muscles have intercalated discs as their identifying feature. Colon can be distinguished from the rest of the gastrointestinal tract by the absence of villi. compact bone contains characteristic Hervatian canals and concentric rings called Hervatian system. Lacunae are holes within this system inhabited by bona fide bone cells called osteocytes. There are three types of cells in the bone. Osteocytes are the mature bone cells. Osteoblasts are cells for building bone, while osteoclasts are light cells which break down bone. Duodenum is part of the gut. The submucosa of the duodenum seems to merge with the lamina propria, and it contains so much glands which are called Brunner's glands. Epithelium can be classified by two methods: layering and the shape of the cells. Layering. If one single layer of cell is on the basement membrane, the epithelium is said to be simple. If there are many, it is said to be stratified. For the shape of the cells, squamous cells are pavement-shaped and flat. Cuboidal cells are as tall as they are wide, that is, they are isodiametric. Columnar cells are taller than wide. Other cells are atypical, like transitional and pseudostratified. This structure resembles the skin because it has similar stratified squamous epithelium with the skin. Its muscularis muscosi is not fully developed, but its muscular layer is very thick. fallopian tube is also called uterine tube or oviduct. It is divided into 4 parts or segments called infundibulum or preampulla, ampulla, isthmus, and junctura or uterotubal junction. It has numerous mucosal folds which help to increase its secretory surface. It secretes various substances which aid gametic and embryonal manipulation before implantation. The area in the picture is the ampulla. Note its numerous mucosal folds which are not villi because the projections are from the underlying lamina propria. The muscularis externa is staying pink. Differential diagnosis. The fallopian tube can be confused with any luminal organ such as appendix, trachea or bronchi or small intestine. The small intestine has villi and not mucosal folds. Trachea has pseudostratified epithelium and no columnar cells, and the appendix is devoid of villi or mucosal folds. Gallbladder has no muscularis mucosae, and hence its mucosa consists of only lamina propria and epithelium. Its submucosa merges with the lamina propria and its external coat is fibromuscular. Its epithelium is simple columnar. It has mucosa folds like fallopian tube but not villi. Is a specialized structure consisting of differentiated cell or cells. Any specially differentiated cell or cells elaborating chemical substances when the chemical substances are useful for metabolic process is said to be secreting. When the glands elaborate non-useful substances, the process is termed excretion. Glands can either be unicellular or multicellular. An example of a unicellular gland is the goblet cell, which secretes mucus. A broad classification of glands recognizes 2 types of glands: exocrine and endocrine glands. Cartilage, when compared to other cartilages, is very vascular and cellular. It has numerous chondrocytes, and its characteristic hyperplasia and glass-like appearance are diagnostic. It is homogeneous in appearance. It is found in costal, nasal, laryngeal, and tracheobronchial cartilages. It is also found in the fetus and adult as temporary cartilage before ossification and in articular surfaces. articulation of developing bones contain high amounts of cartilage. Kidney. The kidney is divided into a peripheral cortex, internal medulla, and a middle-renal pelvis, which communicates with the pelvis of the ureter and in turn joins the ureter. It is the most internal part. Its medulla contains mainly tubules which extend into the cortex via the medullary rays. The cortex, on the other hand, has numerous glomeruli and only a few renal tubules or considerable convoluted tubules. There are very few glomeruli in the medulla. The pelvis collects urine from the renal tubules via the minor and major calyces. The main diagnostic feature of the kidney is the cortical glomeruli, which may be confused with islets of Langerhans in the pancreas. Differential diagnosis. Kidney can easily be made out from thyroid and pancreas by examining the features of those glands. Pancreas has characteristic light-staining islets with ducts and septa. Thyroid has pinkish follicles which cannot be missed easily, and testis has thick tubular walls. Unique amongst all organs of the body, for it is easy to recognize its distinct polyhedral-shaped hepatic lobules, which are the functional units of the organ. Each lobule is separated from the other by interlobular septa and has a central vein to which all the peripheral veins drain. In the periphery of a lobule is a portal triad consisting of portal vein, hepatic artery, and interlobular branch of the bile duct. The bile duct collects bile from the bile canaliculi, which are insulated between the liver plates. Between the liver plates are the sinusoids. The liver plates form the parenchyma of the organ, and they run from the central vein like spokes on a bicycle wheel. They contain hepatocytes or liver cells. lymph node is the center of lymphocytic activity and hence has many lymphocytes. Its appearance in hematoxylin eosin stain is therefore bluish in color. It is made up of a peripheral cortex and a central medulla. The cortex contains many lymphocytic nodules whose centers are light staining, containing the germinal centers for the proliferation of lymphocytes. Differential diagnosis. Lymph nodes can be confused easily with the spleen, thymus, and tonsil. All are lymphatic organs and they have lymphocytes in abundance. Examine their features which aid their recognition. These nerves can be easily confused with the cross striations of striated or skeletal muscles, which are seen in very high magnification and therefore can be distinguished. And we also have darkly staining nodes of Ranvier, which are clearly visible on higher magnification on nerves. Differential diagnosis. These nerves can be easily confused with striated muscle and tendons, but striated muscles have cross striations and tendons are clear without nodes. Is covered with germinal epithelium. It has many follicles in varying stages of development. The mature follicle is called Graafian follicle. The ovary releases the contained egg through the Graafian follicle at ovulation. After this release, the remaining follicle forms the corpus luteum. Differential diagnosis. The ovary can easily be confused with other structures, especially those that have follicles. But the follicles of the ovary are usually in varying sizes as opposed to the same size of the follicles in the thyroid gland. The pancreas is easily recognized by its many ducts and septa, including the acini, which are the basic functional exocrine unit of this organ. The islets of Langerhans are the basic units of the endocrine part of the organ, and they are prominent features which may be confused with the glomeruli of the kidney, but which can be easily distinguished by the numerous tubules in the kidney. Differential diagnosis. The basic exocrine unit of the organ called the pancreas is the acinos, which is shown staining pinkish and surrounded by bluish staining secretory cells. Parathyroid gland has anastomotic cellular cords as opposed to the hepatic plates. It can easily be confused with the liver. It is embedded in the thyroid gland and separated from it by a capsule. Differential diagnosis. Parathyroid gland can easily be confused with the liver, but note the differences in their contained parenchymal cells. The hepatocytes radiate as plates from the central canal, and they are arranged in hepatic lobules. Parathyroid has no lobules and no central vein. Thymus and spleen have no anastomotic cellular cords as parathyroid gland. The pituitary gland is divided into three parts: a pars anterior, which is the anterior lobe, a pars nervosa, which is the posterior lobe, and an intermediate area called the pars intermedia. Its cells form anastomotic cords and may be confused with the plates of a liver. It is a compact gland with little space between the parenchymal cells, but there is more space in the posterior part of the gland than its anterior. Differential diagnosis. The very compact organs like liver, spleen, and lymph nodes can be confused with the pituitary gland. Firstly, liver has plates which radiate like the spoke of a bicycle wheel. Pituitary gland has cells which form cords rather than plates. Spleen has distinct red and white pops, and lymph nodes have distinct cortical nodules with light staining centers called germinal centers. Pseudostratified epithelium. This epithelium is found mostly in the respiratory tract. Its main feature is the fact that although one cell layer only lies on the basement membrane, the cells are in more than one level of height, and hence the appearance of a double or multiple layering. Rectum. The stain used for the rectum shows distinct layers of the rectum. Salivary glands. Salivary glands vary in their structure from mucous to serous glands. The sublingual gland is predominantly mucous, just as submandibular gland, but the parotid gland is completely serous. Hence, we have in this picture mainly mucous cells surrounding a central tiny secretory lumen. Differential diagnosis. Pancreas has acini with secretory lumen, but can easily be made out by the lightly staining islets of Langerhans. Prostate gland is muscular. The muscle fibers are a giveaway. The breast too contains secretory alveoli, but their secretory lumina are bigger than those of salivary glands. Simple columnar epithelium. In this picture, the jejunum is thrown into circular folds with numerous epithelial crypts containing the core of lamina propria. Goblet cells which secrete the mucus are scattered around the epithelial layers, and the crypts, which are glands, having white cotton-wool appearance. At the end of the epithelial layer is a prominently stained muscularis mucosae. Then a highly vascularized mucosa follows. The muscularis externa is the most external structure, containing two layers of muscles, saccular, which is inner, and longitudinal, which is external. villi of the small intestine are quite easily seen as finger-like tall projections from the epithelial glands rather than from the mucosa as folds. Compare with the fallopian tube. Recognized by its alternating white and red bulbs constituting the splenic pulp. The white pulp contains and stains purple and contains numerous lymphocytes, which are white blood cells, called splenocytes. The red pulp contains red blood cells. They are dispersed in splenic trabeculi, seen easily on higher magnification. Can be easily made out by its numerous gastric pits and its the fundus. Squamous epithelium. A stratified epithelium is one with more than one cell thickness on basement membrane. In this case, the epithelium is mainly layer thick. Its cells are also flat and polyhedral, suggesting they are squamous cells. Hence, the epithelium is stratified squamous epithelium. The basement membrane is clearly visible as darkly staining in the basal part of the epithelium. It marks the end of the epithelium and the beginning of the lamina propria, a connective tissue structure which is highly vascularized with many nerve endings that is part of the mucosa. The mucosa itself has 3 structures in the gastrointestinal tract and 2 in other areas. In the GI tract, the structures are epithelium, lamina propria, and muscularis mucosae. Muscularis mucosae is absent in tissues other than the gastrointestinal tract. Striated muscle. Cross striations of striated or skeletal muscles are seen easily in higher magnification. Differential diagnosis. These nerves have distinct nodes of Ranvier, and tendons don't have cross striations. This can be confused quite easily with striated muscle. Tendons. Tendons have highly packed collagen fibers, which have more fibers than cells. The cells are fibrocytes that assist in the formation of collagen fibers. They have faint longitudinal repetitive striations. Testis. Testis is made up of functional units called seminiferous tubules. These contain germ cells in various stages of development. The most primitive are the periphery of the tubules, while the most mature are found in the center, and they include the spermatids. The spermatids are held by Sertoli cells as they complete their final maturation process. Mature cells are smaller than primitive ones. Interstitial cells lie outside the tubules. Differential diagnosis. Testis can easily be confused with luminal, multiluminal organs like kidney and thyroid gland. The follicles of thyroid gland are smaller, and follicular cells are simple cuboidal. Seminiferous tubules have stratified epithelium. Thymus. The thymus has nodules with cortex and medulla. Corpuscles of Horsol are scattered in the nodules. The corpuscles of Horsol or thymic corpuscles are the large red cells seen clearly in this magnification. They are diagnostic of the thymus. Differential diagnosis. Thymus can be easily confused with other lymphatic organs such as spleen, lymph node, and tonsil. All have nodules except the spleen, which has pulp. But thymus has distinct corpuscles of Horsol, while the others don't have it. The sphenic pulp is the diagnostic feature. Thyroid gland is unique in having numerous follicles, which are surrounded by follicular cells. Parafollicular cells, which are light staining, are not found in the follicle. The follicles are cuboidal in shape. The tongue has similar stratified squamous epithelium as the skin. It also has projecting papillae at its surface. Its external layer is the muscular layer, which is striated. Tonsil has numerous lymphatic nodules with germinal centers like other lymphatic organs, but it does not have the corpuscle of Husserl as in the thymus or red blood pulp as in the spleen. Can be recognized by its pseudo-stratified epithelium, which has cells that carry cilia. Its submucosa has numerous glands called trachea glands, and its adventitia, which is the most outermost coat, carries both hyaline cartilage and muscle fibers. Transitional epithelium is the bona fide urothelium of the urinary system, beginning with the kidney collecting duct and extending through the ureter to the urinary bladder and proximal part of the urethra. It is about 4 to 6 layer thick and hence a bona fide stratified epithelium. It is a stretching epithelium and it can stretch for a great length without distortion. When not stretched, the basal cells are cuboidal in shape. The surface cells are larger and octoploid. transitional epithelium which lines its internal surface. It is a leakage-proof epithelium which does not allow urine to be absorbed back into the blood. The urinary bladder can be confused with luminal organs with large outer coat musculature such as tongue and esophagus. Esophagus and trachea have stratified squamous epithelium while the urinary bladder has transitional epithelium. The human uterus is a unique organ, for it is cyclical and therefore allows structural changes within the cycle called the menstrual cycle. It has three coats: endometrium, myometrium, and perimetrium. The endometrium is further divided into three parts: a compact layer, a spongy layer, and a basal layer. Below the basal layer is a basal lamina propria, followed by the muscular coat. Its epithelium is made up of simple columnar cells which form uterine glands. Uterus can be easily confused mainly with the rectum. Both lack villi, and rectum may have numerous epithelial glands made up of simple columnar cells. But the mucosa of the uterus containing the epithelium and lamina propria is very thick. Difference carries sperm from the testis to the ejaculatory duct, which then enter the prostate gland. For this function, it has a lumen with appropriate pseudo-stratified or columnar epithelium, which is ciliated. It also has thick muscular coat. Its submucosa is formed by its thin lamina propria. Vas can be confused with other small luminal organs like appendix, ureter, bronchi, or fallopian tube. Nevertheless, it is still considerably smaller and more muscular than all the above. Yellow elastic cartilage is made up of chondrocytes surrounded by elastic fibers which take dark stain with silver salts. They are found in the epiglottis.